Alright, good morning. I'm going to do oral care today. So always before I enter the room, I always check the patient's chart, and then I'm also going to wash my hands before I enter the room and make sure my hands are clean. Make sure I also have the appropriate attire on, like a mask, my gloves. Make sure I'm staying pretty clean when especially going around the patient's mouth so I don't spread anything to them. So when I'm ready and I got all my safety gloves and everything ready to go, I checked the patient's ID band, also checked and listened to them, see how they're doing with their endotracheal tube. So always before we begin, we always want to check to see where the patient is at with their endotracheal tube, see kind of where it's placed at, and see if it sounds okay. And so once we're ready, then we'll always connect our suction, everything up to our suction machine here. So we would suction it, we would have a wall outlet here. We're going to connect that to there. And we always check the pressure before we even suction into anything around the patient. So we want to have like a -100 and -120 pressure. So when we're ready and got everything's checked, everything's hooked up, and then we'll get our first thing ready, which is our anchor. Here, we're gonna go ahead and get this ready. So this is what we're gonna do. We're gonna go ahead and we're gonna suction the patient to always make sure everything looks good, suction any excess things in their mouth. But before we always suction, we always wanna check to see, make sure there's no sores that are developing in the patient's mouth, so that way we can chart it if we do notice something. So when we're ready, so we got this hooked up to our suction catheter. So we're gonna have another tubing here, so we can hook it up to here. So here, then you would turn it on. You turn it on, and then you would make sure that you can hear the suction, make sure it's suctioning properly, and then you can go ahead and begin. So when you're ready to begin, you can move this back. This is just a protective cover to help keep it clean and sterile. So we're gonna go ahead and turn it on. So what we would do is we get on the side of the cheeks, anywhere where they might have some excess. Try to get the back of the mouth, but try not to activate their gag reflex, so that way they don't start having anything like that. So when you're done with that, always turn it off and cover it back up. And so then when you're ready to start your cleaning, you would remove this, but place it in a safe area, so that way you can use it again. So once we have that in our safe area, so we'll get our first cleaning kit out. So you always want to clean every 2 hours. So here's our first one. So we're going to go ahead and get everything ready. So we have our solution. And so what we're going to do is we're going to connect this to here. And so you don't want to have it turned on or anything until after, so you don't have to have this suction on. So what you do is you dip it into your solution here, and then you would take it into their mouth, and then you clean the side of their mouth, tongue, up on their palate and everything. Make sure everything is nice and clean. And then you can turn on your suction to clean any excess, any material there. And then so when you're done, you can dispose of this. You can't use it again. So when you're done with that, you dispose of that. And then if you see any other secretions that you missed, you can also go ahead and go back and use your other anchor and then suction it out. But then after you have it all cleaned out, and then you take your other one and you take your moisturizer, okay? So you'd spread the moisturizer, you'd put a nice glue up there, but then you would want to spread it evenly, so you just use this since it's clean. So then you just spread it around like that. And so then you would first start in the mouth. You go on the sides of the cheeks, around, up mouth, and the palate, tongue. Then always, so like when they have it, sometimes they'll have a thing that can move your thing, so that way you can get both sides of mouth. So you'd go do on one side, you'd move it to the other and clean it out there too. And so then when you're done with this, done with moisturizing the lips and everything, you would dispose of that. And so you would do this every 2 hours. So after the 2 hours has passed, so you come back and check it and section out anything that you may need. And then our next one would be the toothbrush. So we get our solution out, And then we'd get our toothbrush, and this toothbrush can be connected to your suction. And so you don't want to turn it on yet, but you would put it in the solution, then you would go ahead and brush their teeth like what you would brush your own at home. Make sure you get your nice circular motion, so that way you're getting the teeth nice and clean. Make sure you get the back of the teeth and everything is nice and clean. So when you're done with that, you dispose of that, and then you go ahead and grab out another moisturizer. And so then you'll get the moisturizer, put the stuff on there, and again, go in the side of the cheeks, make sure the mouth is nice and moisturized, and you would moisturize their lips and everything. Then you dispose of that. And then after another 2 hours pass, then you come back and make sure you suction it and make sure you do Phthgotic. So what you're gonna do with this one, you're gonna connect it. So you wanna try to keep it as clean as possible since you're sticking it in their mouth. So you always wanna wear your appropriate gloving. But then this one, you would go ahead and go down carefully to make sure you kind of suction a little deeper, so that way you can get closer to the cuff, make sure there's no excess secretion sitting there above the cuff or anything. And so this you can just suction like that. And so once you're all done, so you would always come back every 2 hours to make sure you do your appropriate care. So it would come in a box, and you'd have different steps for every 2 hours what you need to do to clean. So always you want to make sure everything is in a safe area, that way it's not going to get infected. You would dispose away anything that you have used, make sure everything is disposed, like your gloves, mask, anything like that. But before you always leave the patient's room, you always want to double check the endotracheal tube to make sure it's in the proper fitting, still in the same place, nothing's moved. And you can also listen to the patient's cuff to make sure that sounds okay, you don't hear any gurgling, make sure the cuff is at the appropriate inflation. So once you're all done, wash your hands before you leave the room, and always chart every time you do an oral care or anything with a patient.